What are the signs my pregnancy is viable?
A positive pregnancy test is a good sign.
I'm serious.
So am I. If the pregnancy test shows up positive, you're pregnant, and if you test again in a week and the HCG levels are falling to the point that the positive strip fades or disappears, you've miscarried.
I did not know that.
It is more obvious if the doctor does the blood tests. The levels spike when pregnant and rise through the first trimester, but they fall if you miscarry.
What are some other signs the pregnancy is viable?
An ultrasound is pretty sure. If they see a beating heart, you know it is viable.
I heard someone say they had to get rid of a blighted ovum.
That is actually incredibly rare, to end up with a fetal sac but with nothing in it.
But I've heard the term used before.
Unfortunately, too many people use that term to describe a baby they don't want. If it isn't a pregnancy but a lump of tissue, it is easier to terminate.
Someone said that around half of all pregnancies end in miscarriage.
We do not know the real rate. And some of the data on that from women undergoing in vitro had a higher risk of miscarriage for all sorts of reasons.
I'm worried this pregnancy may not be viable.
If you have diabetes, a thyroid condition, endometriosis, PCOS or some other condition that makes pregnancy challenging, the problem is not the baby, it is your body. Talk to your doctor.
I've heard that the pregnancy might not be viable.
Unless you're living in a lead-lined house, there's always the risk of birth defects.
If I have a house with lead-based paint, that could cause birth defects.
Unless you've had a series of miscarriages before, whether due to prior STDs or incompatible blood types, it will probably be viable once you make it a few weeks.
What if it is not?
Talk to the doctor now to maximize everyone's odds of a positive outcome.